Thank you for staying with us here on JoyNews Prime. Now, Ghana will head into this Christmas season healthier and better prepared for COVID-19 since its outbreak in 2020. The Ghana Health Service says there are just 4 people with the virus in Ghana. All of them are without symptoms. Now, hospital beds are completely free. No one is currently in a critical condition or receiving treatment for severe COVID-19. But the Ghana Health Service says we must, however, be vigilant as cases are rising in other countries, while tourists also prepare to arrive in Ghana. We'll hear from them shortly. But first, how will the country fare as there are no mandatory protocols in place this Christmas?
At the height of the COVID-19 outbreak in Ghana, President Akufo-Addo announced Ghana's first partial lockdown on Friday, March 27, 2020. At the time, Ghana had recorded 137 cases and 4 deaths. The lockdown, according to the president, was to help curb the spread of the virus. At the time, the number of passengers in public transport was reduced, nose mask wearing became mandatory, as well as social distancing at public gatherings. As cases began to surge, the president, in his third address to the nation, directed the closure of land, sea, and air borders to human traffic. By the end of 2020, schools were closed, churches had moved online, and funeral attendance was limited to 25 persons. Although this last restriction was mostly defied. As cases began to decline, the president, in his 28th address, announced a gradual lifting of the COVID-19 protocols. Borders as well as schools were reopened. Currently, the public has returned to full life as almost all restrictions have been lifted. According to data available to the Ghana Health Service, Ghana has a total of 171,023 confirmed cases, 9 active, and 1,461 deaths. But the question is, amid fears of a possible rise in cases after the festive season due to travels in and out of Ghana, can the current relaxed state of protocols help keep the numbers where they are?
Well, we can now hear from the Director General of the Ghana Health Service, Dr. Patrick Kumar-Boaje, who is urging the public to observe all the protocols.
So for Christmas season, we want to reinforce the response to the anticipated surge. And we are providing more reagents for testing. We are reviewing our logistics to ensure that we are ready as part of our capacity building and ongoing engagements with the religious organizations ongoing. So for key recommendations for churches, mosques, and other revenues, irrespective of their size, the use of air conditioning, otherwise, these are the recommendations as follows. Face masks by all worshippers is recommended. And persons using shared microphones, in particular, are encouraged to ensure that they all mask all the time, especially when you are passing the mic from one person to another. It's important that such people wear their mask. Hand hygiene facilities should be available at such venues by the leaders and advised to encourage members to appropriately use such facilities. Sometimes it's there, nobody's using it. Social distancing, where practicable, should be practiced. And of course, we need to remind ourselves about the cough etiquette so that you don't transmit it to someone else. Nightclubs, given the closed nature of nightclubs and the high humidity in such venues, the spread is quite common. So in as much as possible, we follow through with these measures, such as maintaining social distancing, and then should be observed in those places. Club owners are encouraged to provide hygiene facilities, preferably alcohol, hand rubs, out these venues, and encourage patrons to use them. And patrons of these venues are advised to ensure that they are fully vaccinated against COVID-19, and also encourage people that please get vaccinated so that you can protect yourself. Whether it's vigil, concerts, watch night, crossover, we are encouraging that these large gatherings be held in the open, where ventilation is good and that the risk of transmission is significantly reduced.